Hi, this is Dr. Ashok Mehta. I'm a cancer surgeon. I have been practicing for more than 50 years. I was at the Tata Memorial for almost 30 years. And now I am practicing at the Brahma Kumari's Global Hospital in Andheri. This is a small community hospital with 100 beds, but today, in the days of technological revolution, we have almost every technology that is available at any big multi-specialty cancer center. Most of the cancers that we see in males are of mouth and throat, what we call oral cancer and cancers of the head and neck. The oral cancer is common because of the tobacco abuse, which is so common in our country, and people taking tobacco with mawa, etc. Even pan masalas are not good for oral cavity. The important thing when we treat the mouth cancers or throat cancers or cancers of the head and neck, that we should have a good cosmetic and functional result. A good cosmetic is very important because it's a visible part of the human face. The second thing is a functional, because the function of the oral cavity is to chew, also to swallow and speak. So all these functions we must preserve or bring it to near normal. I'm going to show you some of the cancers that we have treated, how we have preserved the jaw, especially the lower jaw, which gives a good contour to the face. Here is a patient who has had a cancer in the lower part of the jaw, and as you can see, it's very close to the teeth. And here what we have done is we have removed that part of the teeth-bearing part of the jaw. And you can see the specimen down there, and this is what is the end result. Before surgery and after surgery, almost 10 years after surgery, this lady looks almost similar. And this is an excellent cosmetic and obviously a good functional result. Similarly, here is another patient who has a cancer of the mouth, which was almost going up to the upper jaw. You can see what we have done is we have removed the entire cancer with the part of the upper jaw, and that defect has been covered with a free flap. That means a skin flap which we had taken with the blood vessels from the thigh and closed the defect. And here is the end result. As you can see, the man almost looks normal, near normal. Here's another patient who has a very extensive cancer, which involved not only the mouth, but also the overlying skin and the jaw. As you can see, what we have removed is extensive part of the oral cavity with a jaw and with the overlying skin. And this is what we are able to replace it with. This is what is called free fibular graft. The bone from the leg is taken as shaped like the jawbone and taken with the skin and is used to replace the entire jaw and the skin as well as inside lining of the mouth. In other words, we have been able to do excellent cosmetic and functional result. This is because of the teamwork. We have a excellent microvascular and a plastic surgeon. We have also a facial maxillary surgeon who helps us to realign the jaws, and an excellent cancer surgeon who puts everything together. The end result is we have near normal patients at the end of the treatment. All these cancers with advanced disease, they also require further treatment by way of radiation and chemotherapy. But the important part is that we should do a good surgery so the long-term survivors have a good survivors. We have long-term good survivors. Thank you. If you want to watch such educative films, I would suggest you go on www.lybrate.com.